Synopsis. In the bone, bright chaos of a military hospital's emergency ward, 25 medics and surgeons fail to pull a beloved and feared war hero back from the edge. When all the machines quiet and the operating room hums with exhausted defeat, a young nurse, Aisha, who carries a private history with blood thinners and an unshakable belief that eyes and hands can see what textbooks miss, finds a small, overlooked bottle tucked into the general's jacket. What she recognizes there unthreads the terrible assumption baked into the room, a clotting disorder driven by anticoagulant medication that no one thought to check. Her insistence, courage, and deep empathy ignite a desperate pivot that bends the arc of a single life back toward the living. The story is a cinematic, emotionally rich exploration of duty, power, and redemption, of a nurse's quiet authority confronting institutional pride, and the cost and reward of refusing to accept that some losses are inevitable. They brought him in on a stretcher that rode the floor with a sound like a distant train. The general's chest rose and fell in stop and start blurs beneath the clear vinyl of the oxygen mask. Fluorescent lights wheeled their thin suns across a row of faces, black scrubs, blood-splattered gloved hands, a jitter of ID badges, collars with rank pins. Machines called, stat lines scrolled and spiked. A corridor full of uniforms framed the doorway like a dry rumor. Someone in the hall said, "Sirrah, they've cut him down." The word cut had the edge of something both practical and obscene. Aisha had been awake since 3. She had seen death before, not as a headline or a rumor, but up, close and clinical, slow and exacting. But there was always a particular hush the first time it came for someone who had been set in bronze. Photographs of the general laughed from the news feeds, a square, jawed silhouette in metals, the man who commanded whole valleys and winters. People called him names in the kitchen gossip and in the radio feeds: hero, butcher, savior, tyrant. To Aisha he was, at first, simply a patient. The uniform drew eyes. The wound demanded hands. They laid him down under the press of white tile, his bleeding quieted by field wraps that had already turned sticky and dark. A colleague shouted observations like a metronome. Multiple penetrating trauma. Left thorax entry, suspected pulmonary contusion. Hypotensive, 80/40. Dr. Malik, tall, with a nose like a ship's prow and a surgical timeline tattooed into how he spoke, barked for the airway, for lines, for blood. The team moved with the choreography of 100 rehearsed deaths. 25 medics would have to be a number, an army against nothingness. The hospital staff said it with weary pride, as if numbers could be a buffer. Aisha was the junior nurse assigned to trauma that night, a last-minute transfer from pediatrics to cover a shift. Her hands were small and quick. She had learned years ago to steady the tremor in her wrist by feeling for another pulse at the same time. She took the bag, valve, mask when ordered, the silicone warm against her palms. The general's breath felt like a thing she could measure by its absence: wet, shallow, riddled with the dark rasp of fluid. The monitor beeped a jagged wrong tune. They intubated him. A tube slid down with a practiced tug. Dr. Malik reached for a chest tube, as if by rote, as if the man were already parts on a tray. They worked. They clamped and cut and tied. Hands like the talons of birds appeared everywhere, skilled and blunt. One medic, a young lieutenant with a face like a schoolbook, kept counting compressions aloud until someone told him to stop. In the middle of the room, under the harsh lens of the overhead, 25 professionals did what the textbooks demanded. For 2 hours the hospital sang with the precise language of failure, asystole, PEA, refractory hypotension. At one point the general's heart did a thin, miraculous flip. A spark, and then it died back on them, as if the effort had been a small, insufficient prayer. A chest drain gurgled. There was a smell under the smell of burned coffee, iron and disinfectant, and something like hot copper. Aisha's gloves were warm with another person's life. She watched faces turn as the machines gave up their little lies, lines flattened, numbers dimmed. The team became, for a few breaths, a crowd. Men and women who had trained to stave off death now held stillness like a test they had failed. "Stop," Dr. Malik said finally. He put his glove on the man's forehead, not as mercy, but with the weary, official air of someone closing a book. "We've exhausted our measures." The words were not unkind. They were a verdict. Someone looked at Aisha because the room always looks for an exit. "Document," someone said. "Notify the family. Code Brown." Hands folded like curtains. The medics who had poured themselves into the man's body started to unpeel from the scene, reinserting themselves into their separate lives. Outside, the corridor kept moving, the hospital a great city where emergencies collided and dissolved with rhythmical cruelty. Aisha lifted the gurney's sheet to tuck the general more carefully. The sheet rustled with something in the inside pocket of his uniform. A small bottle, glass with a white child, safe cap, a label printed in tiny, official font. Her fingers hovered. She had been taught not to touch personal effects until documentation. Security, chain of custody, all the rituals. But the bottle's label had a red-lettered word that the lights made hard to read from afar. She lifted it to the lamp and read, "Marfa Im." A sharp taste came to her mouth. The last time she had seen that name printed on a prescription bottle, it had been in the drawer where her mother kept painkillers and the wilted bouquet of grief after a surgery that had gone wrong. Her mother had been prescribed warfarin for a heart condition, and then the instructions had muttered like a secret. They had told her sometimes to test INR. The little number that said blood would either be too slow to stop or too eager to cascade into clots. Aisha had watched an attended nurse years ago misread a value because she'd had to run to morning prayer, and in the following week her mother bled into a drain and left the world like a poured-out hourglass. That memory had the lucidity of a scare, a room like this one, beeping, the slow closing down of things. Aisha's palms remembered the warmth of that loss. She had come to nursing because she could not unremember the impotence of watching someone slip away. She'd learned procedures and memorized meds and practiced the small audacities that separate a competent nurse from a good one. She had learned to look. "Warfarin," she said, and the sound of the word was like a bell in the shocked hush. Heads turned. Dr. Malik frowned. Someone made a swift, curt hand motion. "You can't," he started. "It's in his pocket," Aisha said. "He's anticoagulated. We need reversal. Vitamin reversal. Prothrombin complex concentrate." Her voice was steady because she had trained it to be that way on long nights and small crises. She had anticipated the look of dismissal, the room's reflex to the young and unproven. They had not checked his meds because they had been busy with the obvious bullet holes and lungs that refused to inflate, blood that poured and pooled. The checks that are routine at the bedside, allergies, meds, last intake, had been trampled under the trampling of fields. But Aisha knew that when you have an anticoagulant in your system and you are cut open like a fruit, 1,000 tiny leaks do not stop, and neither will the cloths. She imagined the torrents inside the man, the slow leaching into cavities, the way a body could become a sieve. "Where did you see it?" Dr. Malik asked, and in his voice was the old calculation. "Is this a rookie's superstition or the meaning of the shift?" Aisha presented the bottle like evidence. The label was worn at the edges, the prescription typed and stamped by a civilian clinic in the capital. The dose was there, the refill stamps faint as a fossil. She had worked at the bedside long enough to read both the words and the life they implied. She turned over the bottle in gloved hands. "He's been taking it. The INR is probably high." She did not pretend the test, the formal lab, would be instantaneous. She felt the back of Dr. Malik's gaze burn her for a moment, then flicked to Captain Navid. The military medic who had carried the general into their hands, who wore the tired arrogance of a man who had seen that his orders meant the world. Navid's jaw tightened. There are codes in military hospitals. You do not question the hierarchy, especially about someone who had the power to put you in a foxhole or in a metal photograph. He looked at Aisha's bottle and then at the general as if an algebra of consequence had rearranged itself. We stabilized the airway, he said. Massive hemorrhage. We gave blood. What difference will that make now? Aisha's answer arrived like a small, clear thing. If the clotting is reversed, we can slow the bleeding enough to get surgical control. If we don't reverse it, no amount of suturing will hold, because the blood won't clot. She felt her pulse in her throat. Her language was not the language of command, but it cut through. She had thought 2 hours ahead of the room. Not merely how to respond to what they saw, but what the unseen meant for what they could do. For a long breath, someone else might have allowed the silence to decide. A nurse's life depends on such brief rebellions, the power to nudge the consensus by pointing to a fact no one else has noticed. Dr. Malik's eyes were unreadable. He had saved lives by the hundreds and lost some to the limits of anatomy. He had a kind of respect for the rituals of medicine and a particular unbelief in miracles. Yet, he was also a man who understood that a decision's merit was sometimes measured by who would act on it. All right, he said. Draw labs. Stat INR. Order vitamin K and PCC. Call blood bank, more units on standby. The words were crisp, but in his face was a flash of something like relief, the loosening of a muscle that had been tensing for defeat. He turned away with the movement of a conductor, and the room began again. They wheeled the general to radiology for a rapid CT as the lab tech sprinted with tubes that looked like testaments. Aisha stayed at the bedside during the transit, harnessed by the need to touch the living. The waiting was a thing hospitals are built on, the space where 1,000 tiny choices hang suspended. When the CT returned with the thin, hyperreal slices of the general's body, it told, in grayscale, the story Aisha suspected: diffuse bleeding in the thoracic cavity, small hematomas that had not yet formed clots, no single catastrophic organ laceration, the kind of pattern that, in a man bleeding with an anticoagulant coursing through his veins, could become a flood. The INR, when the lab tech called it out, came back at 5.8. A normal range is about 0.8 to 1.2. For someone on warfarin, a therapeutic range might sit around 2.0, 3.0, 5.8, is a number that made people speak in quick, urgent syllables. They administered vitamin K in an ampoule, crushing the plastic like a small, decisive sentence. They drew up prothrombin concentrate, cold, concentrated, the sort of medication that sat in refrigerators for moments like this. And Dr. Malik, with the authority of a man who knew the geometry of a chest cavity, directed the initial infusion into a central line. The PCC worked not like magic, but like leverage. It replaced certain clotting factors that warfarin had thinned out, and within a few minutes, that made the difference between tissue that could knit and tissue that would run like water. Aisha held the general's hand, only a nurse's small touch, and watched the slow, incremental return of the monitors from the edge of silence. The EKG, that faithful witness, started to show slivers of rhythm again. It was not all done. The man's chest still held a secret of blood and bruised lung. Surgery would be necessary to find the slow leaks and tie them off. But the tide had shifted enough that a surgeon's suture could find purchase. In the OR, Dr. Malik's incision was calm and precise. The theater smelled of cautery and antiseptic. The team moved like dancers who had learned to respond to the body's small betrayals. The chest cavity, when it was opened, was a dim room in grayscale pooled blood, sliding like oil, and the thin film of coagulated tissue. They found tearing in the intercostal vessels, not a single catastrophic artery, but 1,000 tributaries that had been turned into drains by the anticoagulant. Each clip, each ligature, was a fight for a place to hold. The operation lasted hours. Outside, in a quiet fold of the hospital, Aisha sat on a vinyl chair and let the radio wash light lines across her lap. Sister Miriam, a gray-haired nurse with lilies at the temples and the slow, unhurried sympathy of someone who had seen many kinds of sorrow, sat beside her with a thermos of black tea. "You did good," Miriam said, not as praise but as testimony. "You saw what no one else had the time to see." Aisha's laugh was small. "I saw a bottle," she said. "I saw a name and remembered a drawer." Sister Miriam's eyes were kind. "Sometimes it's the drawer. Sometimes it's the thing we put away because we think the world can continue. We are all, you and I, attendants at the altar of small things." They did not speak of politics. It hovered like an odor around the hospital, in the way certain faces were more guarded when they passed a uniform, in the hush with which certain visitors were ushered in. The general was, in many circles, a man who had sat at the head of hard decisions. For some he was a protector, for others he had been a jawbone of judgment. There had been protests, banners, videos. There had been families with names that mapped to casualties. The ethics of saving him felt like a private conversation in Aisha's chest. Saving a life is not a moral endorsement. It is a choice that burdens you with the weight of possibility. When the general came out of surgery, pale and bandaged, and still under sedation, his pulse slower but steady, someone asked, the way people do with things that need to be marked, "Who called the med?" "An ER nurse," the surgical tech said without hesitation. "Aisha Khan. She found the medication." There was a ripple through the hospital that friction could hardly explain. Not quite pride, not quite surprise. People were charitable with their astonishment when a woman in her 20s cut through the assumptions. The higher-ups noted the report. The news feeds would eventually make a small, crisp headline. "Young nurse's quick thinking saves general." The headline fit a tidy arc, but the room's memory held more nuance. The way a junior nurse turned her small personal history into a tool in a moment that could have been lost under the crush of protocol. In the days that followed, Aisha became a small legend in a hospital that ate and reshaped legends like bread. She received official commendations, a letter, a form to sign, the way bureaucracy knits bravery into paper. Dr. Malik gave her a private nod, an acknowledgement that did not need to be inflated. Captain Naveed, who had at first bristled at her intrusion, stopped by her station with the simplicity of a man seeking a truce. "I was wrong to shut it down," he said, not as apology but as admission. "You have a steady eye." Aisha accepted the words like currency she did not expect. "Was saved him because you all did what you do," she said. "You stabilized, you worked. I was just watching the pocket." The days wound like a spool. The general opened his eyes in the intensive care unit with a slow, reluctant focus. He could not speak at first. The tubes made language a labor. The nurses bathed him with the quiet choreography of those who keep vigil, measured rubbing of palms, the small ritual of mouth care, the folding of hands like a careful origami. When he finally did speak, the words were raw and simple. "Who is she?" he asked. His voice was a map of desert and dust. They told him. He stared for a long time at Aisha, because his eyes, for all their commands, were new in their need. Power has a peculiar hunger. Those who are used to being given homage find it difficult to recognize the particular kind of attention that is not fawning. Aisha approached the bedside on the permission of the nurse in charge. She had not sought him out. She had offered what had been within her power. The general raised a hand like a cautious truce. "You saved me," he whispered. The words were not a boast, but a confession. The room shifted. People who had once crouched in judgment now watched him with something like the humanist awe of a man who had been given time. In the weeks that followed there were interviews, carefully scripted encounters in which the general met children, visited hospitals, made statements about reform. There were others who watched through the net of politics and found irony in the salvation of a man many had wanted to see fall. Aisha did not want a medal. She did not step into the light. She returned to her station and her rounds, to the damp, pragmatic intimacy of administering drugs and replacing dressings and listening to people tell their small, stubborn stories. But the world of the hospital had shifted for her. Her voice carried an urgency that it had not borne before. She found herself asked to join committees, to teach a seminar in trauma triage. Her mother's ghost was still in her chest like an unfinished sentence, but it had been amended, not erased. She also found that some nights, when the ward was quiet, she would stand at the window and think about the long tail of consequence when you reach into pockets and pull out the small things that mean life. There were those in the town who called her a traitor because she had saved a man they believed had done harm. They spoke in harsh comments beyond the hospital's walls, in the bruised anonymity of social media. Aisha had expected that. She had not come into the world of saving because it was kind. She had come because it required her to make choices that left her less certain but more certain of herself. Saving life is not always the same as endorsing the life you save. Months later, when the general had recovered enough to be moved to a rehabilitation unit, he requested a private meeting with her. The request arrived like a folded flag terse, official, steeped in the nervousness people have when they are about to reveal something they know might change everything. They met in the corridor outside physical therapy, a place of rubber soles and the thin scent of alcohol. He was walking with the help of a cane, shoulders slightly narrower, without the weight of his command. Up close, his face showed the fine map of age, of decisions that had burned and calcified. He looked like any man who had been given time he had not planned for. "You did not have to save me," he said. The statement was not what she expected. She had expected gratitude, shaped like medals or speeches. This was quieter, arterial. "You did not know what I had done." Aisha's hands found each other, the reflex of a nurse who keeps a human together with linen and patience. "I did not know your deeds," she said. "I only knew that your body had blood." He laughed, a small, rasping sound. "That is probably the truest thing anyone said to me in a long time." He looked at her as if trying to weigh the balance of a life. "My son was killed in an operation I ordered. I have signed paper that changed the geography of people's lives. I have been loved and despised in equal measure. I do not expect absolution." Aisha considered him. It is a strange thing to hold the hand that has signed orders, to be the one who steadied the hand in the hour when the world shrank down to a single, mortal point. "I do not offer absolution," she said. "I offer what I give to everyone who comes through these doors, the chance to continue. What you do after that is for you." He looked at her then with a steadier gaze. "What will you do with the chance?" he asked, and the question was practical as a scalpel. She thought of her mother's drawer, of the way small mistakes ripple into loss. She thought of Sister Miriam and Dr. Malik and Captain Naveed, and the 25 hands that had failed until a bottle provided a line. "I will keep asking questions," she said. "I will not let the habit of assuming someone is beyond saving or beneath saving bind me. I will look in pockets and in histories. I will teach others to look." The general's shoulders dropped in a gesture that could have been gratitude or the easing of a man unburdening the fact that someone had seen him as a patient, not a symbol. "Then go teach me," he said. "Teach me how a man who has made so many decisions learns to live with them." Aisha smiled, and it was small and wary and honest. "I don't teach generals," she said, but there was a promise implied in the joke. They both knew life had a way of making teachers out of any who survive it. The scandal that followed. For there was always a scandal when a figurehead dances with death and returns to light. Did not touch the core of what had happened. There were inquiries, yes. Journalists found it possible to make narrative into accusation. The hospital was careful with its reports. Veterans groups debated. Protesters held signs. Sometimes righteousness and gratitude coexist in the same air and suffocate each other with heat. Aisha's life returned to a surprising measure of ordinary things: the soft scrape of gauze, the night shift taxes, the small updraft in the ward when someone's fever broke. Yet she kept, in a drawer in her locker, a copy of the operation report. She read it on long shifts, sometimes as if each word were a small, private lesson. The report, dry and bureaucratic, listed the chronology: arrival, interventions, intubation, chest tube, transfusion, lab values, INR 5.8, vitamin K and PCC administered, surgical exploration, ligation of intercostal vessels, chest closure. The words held the weight of causal chain and the human calculus of who noticed first. Her name appeared as a note: discovered anticoagulant, initiated reversal protocol. The typewriter's impression seemed, to her, like a small blessing. There are things that brave people do without thought. A glance into a pocket, the willingness to interrupt a room full of higher-ups. And there are things that happen when those choices are made public. People will try to fit you into their stories: the hero, the meddler, the scapegoat. Aisha let them carve what they would. She continued to be who she was, someone who watched the small ways people gasped in blood and needed someone to notice. On the anniversary of the day the general had been brought in, a thin, meditative week they marked in the staff room with a misfired cake and a laugh that would not quite hold. Dr. Malik found her pouring coffee. He placed a hand on the counter and regarded her like a man considering the distance between then and now. "You saved a lot more than a life that day," he said softly. "You saved an idea." "What idea?" she asked. "That the smallest observation can change the course of a thing everyone agreed on," he said. "That humility in the face of the body matters. That courage sometimes looks like a nurse asking about a bottle." She looked at him and saw, for the first time, the shape of a man who had perhaps thought himself invulnerable to the small. "We all learned that," she said, "even those who resisted." He nodded, and they both watched the kettle sing. Outside the windows, the city continued its indifferent orbit of cars and people, of stories that made the morning papers and those that did not. Inside, they were bound by something that did not fit headlines: the patient, the medics, the nurse who had seen the bottle in a pocket and remembered a drawer. Years later, Aisha would sometimes go back in memory to the night the stretcher rolled in like a train, and to the bottle beneath the sheet. She realized then how close she had been to the same helplessness that had once stolen her mother. She thought of patients she'd lost since, of those she saved, of the way each life bends the arc of someone else's. She understood the dangerous, luminous power of a small act to reach into a pocket and pull out the thing that changes the mathematics. The general's political life continued to be a knotted thing of fervor and protest. He made speeches, he decreed changes, he negotiated in rooms where maps were folded and unfolded. But to those who had been in his ward, there remained, in an unadorned corner of memory, something simpler: a man who had been stopped by blood and saved because one nurse remembered her mother's name for the medicine. It is an image not likely to end argument. It is, however, enough to make life at least a little less fatalistic. In the quiet that followed all the noise, the medals, the inquiries, the comment threads that chewed and spat, Aisha went back to the bedside of another patient, a young father from a different valley who had come in with a broken arm and a story that would take him home to his children. She adjusted his pillow, smoothed the sheet, asked the necessary, small questions because she had learned not to assume. "Any medications?" she asked, and the man looked at her with relief like a domestic light. He had a bottle in his jacket labeled something else entirely, but the habit had been formed. Check the pockets. She smiled at him with the soft professional interest that nurses carry like a cloak, and thought of how small acts accumulate. Like stitches in a seam, somewhere, a machine beeped. Somewhere, another life found the chance to go on. She had not saved the world. She had not, in the end, solved the large moral problem of how to treat a man who had both given and taken so much. What she had done was simpler and rarer. She had found something that others missed, and, because she had the courage to say so in a room of people who could not afford to fail, she had bent the arc of one life toward another day. When people later argued about whether the general deserved saving, she had an answer that was neither defiant nor small. "I am a nurse," she would say. "Our job is not to judge who walks in the door. Our job is to make sure they can walk out of it." Then she would return to her rounds as if to instruct the world in the small, crucial ritual. "Look closely, and when you see something, say it."